Hi, this is Dr. Artie Kavanaugh from University of California, San Diego, and I'm coming to you from ACR 2021 Conversions Virtual, and on behalf of Room Now, which has been covering the meeting to a really great extent. And I would definitely encourage people to go on Room Now, where you've got a lot of people covering a lot of the sessions, quite a number of sessions at the meeting, and some of them are overlapping. And although you can certainly go back and listen to some of them over again, it's just seems like it's never as good as just watching it when it's initially live. You get to see really the questions come out in real time, and that some of them are answered, some of them are not, but it's certainly a lot of information out there. Been a couple of presentations on a sort of the impact of socioeconomic factors and race on different outcomes. So several of them, one this morning was on pediatric lupus, one yesterday was on lupus. And I thought those are very interesting presentations. It's something we've certainly known about in rheumatology for some time, looking at groups of people who are more or less likely to get joint replacements, for example. So we've known this, and I think that people have sort of scratched their heads about how to address this in a way to make sure that really the most people enjoy the best outcome for any of the interventions that we have, be it a intervention or be it a therapeutic program of one sort. One of the things that struck me about these posters, though, is how complicated they really are. You try to look at any given factor and just say race and outcome of lupus nephritis. And you can do that, of course, but then you have to consider so many of the variables. And really, I really enjoyed watching these presentations and just watching the comments go up and down the side, because a lot of people were putting in comments or just commenting in the chat section, and just the number of things to consider that could possibly confound the ultimate observation that was made, namely that say this group of people had a worse outcome with the lupus nephritis than a different group of people did. You have to consider not only age and sex, of course, but socioeconomic status, but beyond that, area of residence. And certainly there's been some of this in the allergy immunology literature, particularly with asthma, where it seems to be more direct, where you'd say, well, the closer you are to an inner city, or where if you live next to a big highway, then you're going to have more pollutants that could certainly have a very direct impact on reversible obstructive airway disease. But I think the same thing holds relevant for studies in our diseases, such as SLE and probably other rheumatic diseases as well. I think when we think about the exposures, we always talk about the rheumatic diseases being some genetic predisposition, although that's not super strong. But then really the epigenetic influence, which probably relates a lot to what the allergy folks are calling the exposome, the things you're exposed to. And of course, some of that would be the microbiome, but other that would be environmental. We certainly know about the relationship with cigarette smoking and rheumatoid arthritis, but I think the area that you live in, you really the micro area that you live in, and kind of the quality of air, quality of water that go in and there, probably going to end up being an important factor. So it's good to have these studies, but boy, once you get in there and see the data, it just raises more and more questions about other factors that you need to know about to be able to really make any statement about causality. And that's what we want to see with these studies. So really, disparity is a hot topic. And I think we've seen some presentations at ACR, but I think we're still in the early phases of learning about how best to do these studies, how best to configure them, and what sort of data we really need to get out of them to really be able to interpret them. So still more of the meeting to come. Thank you for watching. And this is Artie Kavanaugh coming to you for Room Now at the ACR 2021 Conversions.